Today's discussion is how childhood trauma can affect your adulthood, how it can affect the relationships you are having, and how it can affect how you feel about yourself. I'm Jessica Ann Pressler, licensed clinical social worker, coming to you from the West Coast, California. And
And I am Sylvia Puentes, nurse entrepreneur and faith-based coach and mentor coming to you from the East Coast, Florida.
and we're here joining together to help discuss many different subjects, but this week we're discussing trauma. And we know it well between the two of us. We have been friends for over 20 years and have dealt with each other's trauma. And one thing that I'd like to point out is sometimes what comes up in adulthood is we are triggered. Our childhood trauma is triggered. It's often triggered in our relationships, and we'll be discussing that as well. Now, when I talk about childhood trauma, I'm not just talking about an event like a car accident, a death, a rape, all these very painful events that could happen in childhood. But I'm also talking about the trauma of being in a family where you're not being validated, where you're not feeling safe emotionally and physically, where you're not feeling loved, where everything is conditional, where your feelings are, as I said before about being validated, where your feelings are not validated, where you're bullied in a family, where you're not recognized for who you are. Do you have any thoughts about that?
Absolutely. It's the root of what can later on in life cause us to have repeated patterns of um, difficulty in relationships, romantic relationships, and other, even friendships. So that's why it's important to recognize these childhood traumas. And as you said, it's not limited to big events. It could
Right.
just be, things that the just basic the nurturing or lack thereof that happened in
Hmm.
your childhood.
It's just so important to feel safe. And I think sometimes in our adult romantic relationships as well as other ones, we're not feeling safe. We're trying to feel safe. And in doing so, we may act out. Um, for example, if you're terrified of abandonment and because of your childhood, and you may be desperate to hold on to a very dysfunctional relationship. And in doing so, that contributes, not the cause of the dysfunction necessarily, but certainly contributes to you being in a lot of pain. And so I also like to recognize, I've heard this before, but I do agree with it. Maybe I don't know the percentage, but many times, let's just say you have a couple who's fighting. And many times that fight and the way you act in that fight has nothing to, or minimal, let's say 20% to do with the actual issue at hand, and 80% to do with your triggers, your childhood triggers, and particularly how you respond to it, why it's so painful for you. And these are some of the reasons why a person should address what happened in their childhood, which can be a very painful journey. But we both have done so. And we know that if you can get through that journey, you are going to live a much healthier life.
Yeah, absolutely. And, I'm sure that everyone has heard someone they know say, um, I married my mother or I married my father, and that wasn't necessarily a healthy relationship. However, they end up marrying someone who mirrors that relationship that they had with that parent.
Mm-hmm.
And often that's where you would get, and correct me if I'm wrong here, Jessica, what we call trauma bonding, or what is trauma bonding?
Well, trauma bonding is usually done if you can be, if that's the type of relationship you have, because trauma bonding is something where you're in a relationship with a person who may start off being very loving and caring, may love bomb you. This is usually with a narcissist. and the person will love bomb you, and you're going to feel the high of that wonderful relationship. And then at some point they're going to pull back, and they may do a little, there's no such thing as a little abuse, but there may be a one word, or they may not talk to you for a day or whatever. And then suddenly they'll be nice to you again. And then you may share an event together that's very emotional, and you may feel very connected, and then they'll pull back again, and then back and forth and back and forth. And that's what creates the trauma bond.
Right. So you wrote this really great blog, where you give examples of, what can create the trauma in the childhood. Why don't you share some of that?
Yes, I will. Thank you. So behavior that the caregivers may be doing in the childhood, which can create this childhood trauma, is emotional withdrawal or abandonment, physical withdrawal or abandonment, conditional love, enmeshment, invalidating and minimizing, belittling, lying, broken promises, and betraying, manipulating, emotional abuse, bullying, teasing, laughing at them, physical abuse, sexual abuse, blaming, guilting, caregivers just not meeting the emotional needs of their children, such as love and emotional and physical safety, gaslighting, and refusing to support and protect them when asked. So it will leave a person feeling in their childhood and their adulthood, feeling fearful, unsafe, helpless, hopeless, shameful, powerless, humiliated, trapped, abandoned, alone, rejected, invalidated, exposed, unworthy, and invisible. And as you noted before, that if you're choosing similar relationships, all these, well, whatever the feeling is that you're getting from the trauma will pop up again and again. And that emotional feeling, which for me felt like someone was cutting me with a knife every time I felt that, I mistook it as being the actual person I was with. I'm not saying it doesn't, but I think it's magnified by the pain you're feeling from usually your caregiver and what pain they cause that's being triggered again with your adult relationship.
Right. And as we said, this is during a time, these are, where the safety, the nurturing is so necessary, and it builds the foundation. That's why, when that is compromised, when there's a crack in that foundation, it'll come out, it'll surface eventually in your life, usually in adulthood. Yeah. And then the need is, once there's that awareness, we may ask ourselves, why do I have this pattern, or, why does this keep happening in my life?
It's
go
physiological.
to the,
It's in your brain.
right.
It's actually yes.
Right.
Mm-hmm.
So once that awareness comes, we have to then go to the root, find the root of that, and that's where healing can begin.
Right. Now, some of the ways that it shows up in adulthood is post-traumatic stress disorder, complex PTSD, depression, anxiety disorders, difficulty in relationships, sleep disorders, eating disorders, attachment issues, abandonment issues, codependency, unregulated emotions, phobias, grief, and low self-esteem. And it can affect your body. You can get physically ill from this.
Absolutely.
I mean,
Yeah,
all kinds
absolutely.
of eating, so you can get health issues such as headaches and gastrointestinal issues, back and neck issues, infections that are chronic lung and heart disease, liver disease, et cetera, et cetera. Just, it's endless how this can affect, which I would like to stress that it's really important to do this work. It would change your life. It changes your relationships. It changes the choices in relationships. It changes how you feel about yourself and how you take care of yourself. And so I want to just touch on what the inner child is when we're going to speak then about how to help. The inner child is that part of you, that little child that's still left inside that remembers the actual trauma. Because sometimes we go through life and we've actually repressed it and we don't remember what happened. But there is some part of you that does. And that's the part that's wounded. And that's the part that gets triggered. So I think you had something you want to talk about in regard to a wound. You had a really nice analogy.
Yeah, I have. So as a nurse, I saw many wounds being debrided by surgeons, and a debridement takes place when there is dead tissue, and you want to get rid of that dead tissue to try to salvage what the limb, the organ, whatever it is, the limb. And so you're getting to the tissue that is actually still viable in order to try to save that part. And so the surgeon is scalpeling away at all the dead tissue, and the surgeon will stop at the point where there's blood, where you
Mm-hmm.
get that fresh blood. And though it seems like, oh, who wants to bleed? The blood is a sign of life. The blood is oxygen. So it is painful to get, to go through those layers,
Mm-hmm.
of the dead tissue, of the necrotic tissue, but you get there, you keep going until you get to that point where the bleeding starts.
Mm-hmm.
And that is where there's life and there's a new beginning for, you know, that wound. So in life, as we're going through that healing process, it is called a healing process, but it's a healing process. We first have to get through all of those layers of the unhealthy, the necrotic stuff, the stuff that's dead, that's not serving us and holding us back before we can get to that point of breakthrough. And it can be a very painful process. It's a lot of stuff that has to come out, but there's breakthrough on the other side of that. And, as we've talked about before, there's that abundant life that we're meant to live. I know that when I'm working with someone, I always focus on on the heart, because everything flows from it.
Mm-hmm.
So,
So because of the potential pain that even the end, there's life, but
yeah,
because of the initial pain, it's important that you don't do this alone. You can
right,
you can talk to your spiritual life coach or what do you spiritual
right.
name? Life coach? Spiritual
I'm a faith-based coach and mentor. Yes.
faith-based coach and mentor. I couldn't remember or a life coach, or a or a therapist, and there's wonderful programs. So there's someone that I really like to mention. I mentioned it in my blog at jessicaannpressler.com. Her name is Lisa A. Romano, and she has a program on her website, lisaaromano.com. And one of the things she talks about in healing your inner child are these following tips. To start meditating to help slow down the thoughts and catch unhealthy thinking. So you have to retrain your mind. Journal about types of thoughts you hear yourself saying and repeating. It allows you to see the way you speak to yourself, which may be how others spoke to you as a child. Witness your inner child and ask yourself how you feel. Be the observer of what you are observing. Journaling helps do this. And develop compassion toward yourself. It's basically you're reparenting yourself. Acknowledge your inner child and how she feels. Validate your inner child. I see you. I hear you. I love you. You are enough. And have empathy for your inner child. And get a photo of yourself and keep it out where you can look at it often. And it helps remind you of that there is an inner child that's in there, that's wounded. And
yeah.
I thought that was a really good tips and doing this work, although I don't think anyone should do this alone.
No, yeah, absolutely. I think that definitely, a facilitator always helps to walk you through that. I know that when I've done the work, you have been, tremendous as a friend
As
who
you to me.
thank you, who happens to, be a, clinical therapist, but, again, as a faith-based coach,
It's our time. Sorry. Stop it. I have the timer on everybody because they don't let us upload videos after a certain time. So we are at the end. I'm not sure we could even keep what we're saying right now, but
Yeah.
if we can, don't do this work alone. Do it with a trusted
No,
friend, and with a professional who understands inner child work.
yes,
And there are
absolutely.
programs that you can find as well in groups. There's books out there. Uh, and it is, you probably will feel some pain as you're doing the work, but in the end, as you and I can attest, it's so worth it.
Yes, 100%.
So I'm Jessica Ann Pressler, licensed clinical social worker, saying goodbye. This will be uploaded to Instagram and to YouTube.
And I am Sylvia Puentes, nurse entrepreneur and faith-based coach and mentor.
Bye, everybody.
Hi.